I will now hand over to my Deputy Chairman and NHS Champion, Suzanne Evans.
Good morning. Some weeks are more emotionally challenging than others. This week's been one of those weeks. Emotionally, we put ourselves through the ringer. The organisation chose me for this role because I'm resilient. But don't get me wrong, it's not like I don't go home sometimes, walk through the front door and start crying, because I do. I've never done it in the office. I'll always wait till I get home. But I do, because I've had a day when you just think, that was the day from hell. I don't know what went so horribly wrong there, and I've got to make it right the next day. Those are the words of Leslie Powells, one of the stars of Hospital, the new BBC fly-on-the-wall documentary that lifts the lid on just how overstretched our acute hospitals are. She is one tough cookie. She's not a doctor, so her anguish isn't about losing patients. Leslie is the site director, and she's the one who regularly has to make heart-rending decisions in consultation with medics about which desperately heart-needy patient with a life-threatening condition gets the only vacant bed, and which has their operation cancelled and gets sent home. No wonder she sometimes breaks down. We've all heard about the funding crisis in the NHS and read the headlines about hospitals on black alert, unable to guarantee emergency care, ambulances queuing up outside A&E, patients stuck on trolleys in the corridor for hours on end, unsafe staffing levels, drug rationing, and the latest cutback, denying hip or knee replacements to patients whose pain isn't so bad that they can't sleep. But seeing the chaos in action on our TV screens brings home just how bad it all is. The BBC may be filming at just one hospital trust, but the problems are countrywide, and not least here in Stoke-on-Trent. Health needs in this part of the world are huge. Stoke has the 5th highest suicide rate in England. People who live here are likely to die 3 years earlier than the national average, and that gap is widening. Infant mortality rates are considerably higher than the England average. Teenage pregnancies are the second worst in England, and a quarter of children live in poverty, which in general, of course, means they're not going to be as healthy as they should be. Older people suffer poorer health here too. Injuries due to falls are the highest in the West Midlands, not least because there's a significant shortage of suitable housing for the elderly. Excess winter deaths among older people have risen for the 3rd calculation period in a row, and are higher than both the national and the regional rate. The over 65s account for 70% of all bed days at the Royal Stoke Hospital. So here we have people in desperate need of good local NHS services, but the system that should be caring for them is itself in need of emergency care. The Royal Stoke's one of those acute hospitals that's so overstretched it's working with the Red Cross to try and ease the pressure. A&E waiting times are among the worst in the country. 21% of patients wait more than 4 hours. 336 patients have waited on trolleys for a bed for more than 12 hours since April last year, and 30 patients have waited more than a year for routine treatment. And the Royal Stoke had to cancel 337 planned operations just in the month of November alone, mostly in order to cope with rising numbers of emergency patients arriving at A&E who had to be admitted to hospital. Like every other acute centre in this country, there will be doctors and people like Leslie Powells running around at the Royal Stoke hunting for patients to discharge and send home, or hot-footing it up to the intensive care unit to see if any patients there have recovered sufficiently to be moved onto a general ward. Because only then can a complex, life-saving, planned operation on another patient go ahead, and that patient be put on essential life support afterwards. This is the grim reality of the NHS today. One patient's care comes at the expense of another. It's not what doctors and nurses signed up for, is it? Despite their clear round-the-clock commitment, dedication and expertise, those on the front line are working in the face of intolerable and completely unacceptable pressure. Yet it seems they get little thanks for their efforts. What I call seagull politicians, managers and regulators who don't take much notice when things are going well, But my goodness, they'll quickly swoop in and do what seagulls do best all over these people when they fail. Politicians and bureaucrats have starved the NHS of funding for decades, and worse, they put additional stress on the service with unreasonable demands and counterproductive policies. Mass, uncontrolled immigration, which puts considerably more pressure on the system, is the obvious example, but it's by no means the only one. Umpteen top-down edicts have pretty much set the system up to fail. There have been 9 major top-down reorganisations of the NHS since 1973, an average of 1 every 4.5 years. As one nurse consultant told me during the last one in 2011, it's just all too much. We just got our heads around the last reorganisation and got it working, and now they're changing it again. Without any period of settled organisation, there are major implications for the NHS. It's disrupting for staff and staff relationships. There are huge practical and cost implications for retraining and learning. And of course, the benefits of any previous reorganisations can be lost. NHS staff all too often find themselves working under a kind of targets and terror regime. Too often, politicians who can't be bothered to make the necessary investment in care instead set arbitrary targets to make it look as if they're doing something about a particular problem. Targets so often are not based on scientific evidence or clinical outcomes, but in the short term, of course, they satisfy the demands of a baying press and boost politicians' standing with the public. But to see the potentially catastrophic impact of this short-termism in the longer term, we only have to look to Stafford, just up the road, where chasing centrally imposed targets had tragic consequences. When targets are put before clinical judgment and patient care, the results can be fatal. The fact the NHS is already massively underfunded doesn't, of course, stop politicians making cuts, regardless of any adverse impact or risk assessments. It's also short-sighted. Too often, any cost savings made are dwarfed by the cost of hiring locum and agency workers to fill the gaps left by burnt-out and disillusioned staff. And this is a classic problem right here in Stoke, where NHS workers take an average of 15 days each year off sick, most frequently quoting stress, anxiety and depression, and where agency staff costs across the whole trust and all health provision reached £44 million in the last financial year. When money is spent, it's often spent in the wrong way. Another unrealistic, centrally imposed plan, perhaps, one which, like targets, isn't based on evidence but political belief. Or failing that, there's always a way to waste precious clinical time by insisting on a raft of form filling, data collection, administrative tasks, and pointless statutory training and retraining exercises for staff who don't really need it. Take the surgeon I spoke to recently, who complained about the stupidity of being forced to go on a course to improve his bedside manner, despite never having any complaints in the last 20 years. It's madness. Both Tories and Labour have together created the conditions in which healthcare workers are inevitably going to struggle. And instead of recognising their mistake and correcting it, God forbid, even apologising, guess what? Yes, they blame the healthcare workers for not complying with their unreasonable demands. I admit I was furious when I saw a couple of weeks ago that, having already gone to war with junior doctors, the Tory party's now turned its fire on GPs. Work longer hours, 7 days a week, or we'll cut your cash. That was basically the message. It was typical knee-jerk, soundbite, blame game politics. When we released our general election manifesto in 2015, the Royal College of GPs told us we were at least 8,000 GPs short. So we found the money to train 8,000 more GPs over time. It takes 10 years to train a GP. You can't just magic them up overnight. But how many more GPs would we need to implement Jeremy Hunt's proposals for a 7-day-a-week, 12-hour-a-day service? Well, one of my teams crunched the numbers. We had to do it a couple of times because we didn't quite believe it the first time. And I'll tell you this, it's completely unfeasible. It runs into the tens of thousands. Unrealistic. So Jeremy, I'd like to say this. You promised us 5,000 extra GPs by 2020. But at the rate you're already losing them by being so utterly unrealistic in your demands and being so condescending, you stand no chance. How about, instead of putting so much pressure on our doctors, that 1,500 of them every year quit the NHS for jobs in places like Australia and New Zealand, where they're paid twice as much for half the work, have access to far better facilities, and can spend their free time in the sunshine, how about you get off their backs? But it's Labour's appalling record that I really want to turn my focus on this morning. If Nye Bevan were here today, I think he'd be disgusted with the Labour Party, given the number of Labour policies that have helped bring the NHS he inaugurated to the brink of destruction. Neither he, nor William Beveridge, the Liberal politician whose vision for the NHS Bevan enacted, ever imagined our national health service would be allowed to become an international health service. The NHS wasn't set up to provide free healthcare to the world. It wasn't even set up to provide free healthcare to Europe. It was set up to provide free healthcare to UK citizens. If we want our NHS to remain free at the point of delivery, and UKIP unequivocally does, then we have to make it a national health service again. Since Tony Blair opened the borders in 1997, some 9 million immigrants have arrived in Britain, England mostly, but NHS funding hasn't risen in line with demand. But then, the NHS and quality of patient care for the British taxpayers who were picking up the bill was the last thing blinkered Labour politicians thought of when they welcomed so many new migrants to Britain. No. Top of their priorities was rubbing the nose of the right in diversity, to quote Blair's speechwriter. Political point scoring came first, and still does, which is why it's nigh on impossible to have any kind of sensible conversation with anyone in the Labour Party about immigration and the NHS. Yeah. They still shut down conversation by screaming racist, like latter-day witchfinder generals, and spouting straw man rubbish such as the NHS would collapse without immigrants, or if you don't want immigrants in the NHS, don't let an immigrant doctor save your life. Puerile, pathetic playground. Typical of Labour's response to any serious issue it doesn't want to face. Immigrants are not to blame, Labour is. Then, of course, there was Labour's stupendously stupid buy one hospital, pay for 6 idea. Yeah, that is, isn't it? That's the upshot of Labour's great PFI swindle. Build one hospital, pay for 6. Labour opposes NHS privatisation? Don't make me laugh. The Tories might have written the privatisation instruction booklet, but Labour embraced it and replicated with religious fervour. Labour rebuilt hospitals using private loans at credit card rates of interest, signing contracts that would cost the NHS dearly but make billions for the private sector. In this hospital trust alone, we're talking about a build cost of £415 million, but with total repayments reaching £2.7 billion. As I said, more than 6 times the original construction cost. Labour's dodgy deal is still costing the Royal Stoke Hospital some £58 million a year in loan repayments. Whoa. That's about 8% of the hospital's entire annual budget. Just imagine what that hospital could do with 8% more money to spend on patient care. Labour has utterly betrayed the NHS. They crow about how they funded it. They claim it as their own. But in truth, as Paul said, they're like abusive parents who've been stealing from their own children. Labour is not the party of the NHS, still less the party that will save the NHS. Labour is the party that must never, ever again be allowed to run the NHS. Over the coming months, I'll be developing UKIP's health policy, and in doing so will make it a priority to focus not on political advantage, but on what's right for patients and healthcare professionals. I'll be listening to the team I'm gathering around me with expertise in social care, some of whom I've inherited from the former health spokeswoman, Louise Bors, and all credit to her for putting such a great team together. And together, we'll be seeking and offering practical ways to solve the funding and resources shortfalls that are pushing the NHS to breaking point. What I will not do is create short-sighted, knee-jerk policies which put additional pressure on already overstressed, overfaced and underfunded staff. I want to focus on policies that don't just improve the health of the nation, but which also improve job satisfaction for NHS workers. And at this point, I'd like to remind you that at the 2015 general election, UKIP was the only political party that could both promise an extra £3 billion a year for the NHS, plus an additional £1.2 billion for social care. We were also the only party that could show you where the money was coming from. And I intend sticking with this responsible, common sense approach. So where do we stand on health policy right now? Well, let me too make it crystal clear. UKIP is 100% committed to keeping the NHS free at the point of delivery. And of course it will come as no surprise that we wholeheartedly welcome the fact that Britain's going to leave the European Union, because this gives us the chance to make dramatic changes to our immigration system, which in turn, provided it's well managed, will give the NHS that vital breathing space it so desperately needs. UKIP will continue to advocate for an Australian-style points-based immigration system which will never pull up the drawbridge, but which will make sure those who walk over it are not unwittingly draining NHS resources. To this end, it remains UKIP policy that all new immigrants to the UK should pay tax and national insurance for at least 5 consecutive years before becoming eligible to access non-urgent NHS care, and that they must hold private healthcare insurance for themselves and any dependents in the interim. Our stance on health tourism will remain unashamedly uncompromising. We will put the N back into the NHS. Standing up for the NHS must mean speaking out against those who deliberately come here to drain NHS resources and rip off British taxpayers to the tune of some £2 billion every year. There's huge abuse of the EHICS card system as well, which I'm looking into, and we'll talk to you more about that on another occasion. Both these things have to stop. And in my view, politicians who don't speak out about health tourism are the enemies of the NHS, not its friends. UKIP also remains committed to putting considerable additional funds into the NHS and social care. We promised £4.2 billion extra in 2015, but I hope to announce that soon we'll be going much further than that. My colleagues William Dartmouth and Lisa Duffy will be speaking at our spring conference on the 17th of February about how removing barriers to trade is a far more effective way to tackle poverty and corruption in developing countries than by handing out aid payments. UKIP fundamentally disagrees with the current government's policy on foreign aid, and we're in the process of identifying unnecessary and ineffectual non-emergency aid spending, and we will divert a considerable portion of that money into the NHS. I'm also pleased our policy committee has just recommitted to our manifesto pledge to end the use of PFI contracts in the NHS. The private shareholders and hedge fund managers who invested in them and who are now laughing all the way to the bank sicken UKIP. This scandal must stop, and it must never be allowed to happen again. We also commit to abolishing tuition fees for medical students provided they work in the NHS for at least 5 years after graduating or qualifying. I see my role very much as being UKIP's NHS champion, and that means I'm here to defend our National Health Service, find the money to invest in patient care, and then, frankly, get out of the way. I'm not a medic. I don't have the life-saving skills of a surgeon or the diagnostic skills of a GP, nor the patience or caring skills of a nurse. So the last thing I should do is interfere and stop them getting on with their jobs. The health and well-being of the people of Stoke-on-Trent, who are perhaps in need of the NHS more than most of us, it depends on a sensible, coherent approach to getting out of this crisis, and this is what UKIP will aim to do. We will find the money and the resources to enable the NHS to save lives, provide quality healthcare, and put patients first. In other words, UKIP will put in place the support and infrastructure the NHS needs so it can get on with the job it was created to do, and which, despite all the else, it's still doing remarkably well.